It's there now.
It's working, Senator.
Mr. Chairman, I take exception with some of the statements that were made, primarily that there are no other choices but to have this repeal. Another choice was given yesterday, and I would like, that was based upon a bill that was submitted and heard. It was heard in the first committee on January 26th. And then it sat there and hasn't been heard since. That bill was based on a law passed in Arizona. And I would like to just read something about that bill and that law that was in the Phoenix paper. It states, state proposes tough rules for medical marijuana. Preliminary rules for would-be users and prescribers of medical marijuana in Arizona are so stringent that no more than 20,000 people likely will qualify for the drug, a sharp decrease from an earlier estimate of 100,000 in the first year alone, a regulator said Friday. The revised estimate was made after Arizona Department of Health Services Director Will Humble looked at rules and numbers of users in 14 other states that allowed medical marijuana. We figured, hey, if we put some true checks and balances in the system, we could actually make the medical marijuana program not a recreational marijuana program, Humble said at a news conference. He noted that patients in California can get pot recommended from a doctor for a headache, while hundreds of dispensaries in Colorado opened without any state regulations. Arizona's medical marijuana measure passed in November by just 4,341 votes after 1.67 million ballots were counted, making the state the 15th in the nation to approve a medical marijuana law. Arizona's ballot measure will allow patients with cancer, HIV, AIDS, hepatitis C, and any other chronic or debilitating disease that meet guidelines to buy 2.5 ounces of marijuana every 2 weeks or grow a limited number of plants themselves if they live 25 miles from a dispensary. The preliminary rules posted in the Health Service Department website said a patient must get a marijuana recommendation from an Arizona doctor who has been treating the patient for a year or has taken primary responsibility for their care after compiling a medical history, conducting a comprehensive exam, and reviewing medical records. Patients also must provide a copy of a valid identification card, proof of U.S. citizenship or naturalization, and detailed doctor information. They must pay an application fee of $150 and a yearly renewal fee of the same amount. Doctors, meanwhile, must initial statements saying they reviewed all the medication being taken by the patient for potential interactions with marijuana. In addition, physicians must initial a statement saying he or she will continually assess the patient and their needs for medical marijuana and that their patient is likely to benefit from using the drug. Humble believes the rules won't stop those who truly need medical marijuana from getting it. A newly diagnosed cancer patient, for example, can go to their oncologist.
Senator Vuckovich, even though your beautiful daughter works in Whitefish High School, please wrap up your comments.
I will. It's just a very short now. For that guy in his 30s without any qualifying medical conditions who is going to expect to be able to walk into a physician and get a quick recommendation by saying his shoulder's been sore, those are people that we expect to have a bigger challenge in actually getting a qualifying patient card. And regarding the pot shops, The preliminary rules say the application or the applicants must pay $5,000. This is what Bill number 193 was based upon. I've never had many original ideas in my life, but when I see one that works, I don't mind stealing it. And that's exactly what I did with this bill. And it was never ever heard. Now, isn't this what we want out of a medical marijuana bill? This is what we're trying to get here, something that will work. And this will work if we give it a chance. But we voted that down big time yesterday. Party lines. It went down. Again, this is what we're trying to do with this law. Everybody says they want a law that works. This one works. But we're not giving it a chance. This is not repeal. I think repeal is wrong, and I'm going to vote against repeal, and hopefully I may try to blast this out again tomorrow. Goodbye for now.